Hello, I'm Sandra Viktorova. Thank you very much for being here. Today we begin with the impact the mental health crisis is having on our country and our community. Studies show more young people are dying by suicide than ever before. The Center for Disease Control says more than 7,000 young people between the ages of 10 and 24 took their lives in 2021. We've seen a 62% increase in suicide among that same group since 2007, according to Yale University. The CDC also reported that 1 in 5 high school students have seriously considered attempting suicide. Southwest Florida is certainly not immune to this problem. The David Lawrence Center treated nearly 700 children for a mental health crisis last year, some as young as 6 years old. WGCU's Jennifer Crawford spoke with one Naples woman who shares how she survived her mental health crisis as a teenager.
I learned how to let go of mistakes. I learned to listen.
Chloe Kahn joyfully shares highlights of her day with her father. The 26-year-old Naples resident exudes happiness, enthusiasm, and positivity, a zest for life, a life that may have been cut tragically short as a teenager with thoughts of suicide.
Oh, when I started getting bullied, I was like, I didn't know what to do. In my head, I was just having all these thoughts, like a storm was coming in my head. It was hard for me because my parents were going through a divorce at that time, and I was very stressed about it, and I had a lot of anxiety about it. So I was just like, I don't want to do this anymore, and I just had the thought of doing self-harm.
Chloe has autism and suffers with seizures. She had already been taking part in a therapy program through David Lawrence Centers for Behavioral Health, or DLC, in Naples. During one of those sessions, she revealed suicidal thoughts to her therapist, who told her mother, Lisa Kahn Allen.
As a parent, you never want your child to even think those things, and certainly not act on them. It was a very interesting experience following a squad car with your daughter riding in that off to, the David Lawrence Center at night. But that's exactly what happened.
Chloe was Baker acted.
They put her through their intake process there. She was in for 72 hours.
Kristen Estep is the clinical supervisor for the Emergency Services Assessment Center at DLC.
The key concerns definitely are safety, first and foremost, of the child or adolescent.
Estep says in the past decade, they've seen a dramatic rise in cases like Chloe's.
An average number of children on a crisis unit has increased nearly by 500%. We see a lot of them come from the school system lately. It's been insanely busy with the children, unfortunately. We've had a lot of parents that bring their children here due to comments about suicide or homicidal ideation, kids that self-harm.
It is scary and horrifying and terrifying for family members, a brother to see anything. Everybody will be so upset. And do not be afraid to go find help.
Her mother credits the treatment programs at DLC with saving her daughter's life and her family.
They were the start of getting back on the road to health. It really was the beginning, and it was everything.
In the meantime, Chloe is flourishing. She loves her new job at Macy's.
You have to make sure they're straight.
Has a circle of friends, hobbies, fur babies, and so much to live for.
I realize that my family needs me, my brother needs me. I see myself helping kids with similarities of me, of disabilities, and I see myself having a family, maybe kids down the road, and just having a beautiful life.
I'm Jennifer Crawford reporting for WGCU News.
Thanks for watching. We've got more great content for you, from news to the arts to the environment. So be sure to like and subscribe to WGCU's YouTube channel and follow us on our social media platforms for the stories that matter to you.